in the Improvement Academy virtual session here. And so today's discussion, what we're going to do is we're going to talk about a couple of more tools. And we're going to have some fun. And you're going to get actually opportunities to not just listen, but actually to do some things. So the goal of this session, and we have whatever about 58 minutes now, is I want you to have a pretty good understanding of what a value stream map is, how it can be used in improvement, and more importantly, how to do one, a very high level one, a very draft one. Again, these things, anytime you talk about improvement, nothing is perfect, even though you strive for perfection all the time. There's no such thing as, something has got to be perfect, especially things that we actually do. So in any event, thank you for joining. And I think we have a couple people on the line now. Let's go ahead and get started. Okay, so we always say, be kind, please rewind. These are just some of the things that we spoke about before, process mapping. Today, we're going to talk about value stream mapping and the difference between that and a process map. And then hopefully, like I said, you're going to be able to actually do one. I don't know how this all will work, but what we're going to do, we're going to actually try. Okay? So next slide, please. So Roberto's on vacation this week, so I'll do my best Roberto imitation and impersonation here. But last week we talked about driver diagrams, and basically what are the primary and secondary drivers that you think should be in place to drive a certain outcome. He did a great job also talking about those PDSAs. Think about it, those little aspirin, I like to call it plan, do, study, act. So that's the onus or the genesis of improvement. All improvements, you got to actually experiment and try something, see if it works, capture the data, and then actually make adjustments or implement what you find out. And then that last thing on the bottom there, based on those PDSAs, you can actually adapt it, adopt it, or abandon it. But again, PDSAs are that's the lifeblood of improvement. And everybody can do it every single day, okay? So next slide, please. So Roberto talked about a process map. Now, process map is a series of steps, normally in the order that they occur. So in here, make coffee, grind the coffee, prepare the coffee pot, measure and fill with water, turn on and make the coffee, prepare a mug, and you see how the arrows go across. And it's almost like linear, or you could go horizontal, but it's almost like step by step. And it's a little bit more detailed with respect of the actual process step. Now, a cousin of process mapping, or really an iteration of process mapping, is what we call this value stream map. And so now if you go to the next slide, please, Nisha. So this is kind of like the cousin of a process map. So now let's just say the next slide. And we talk about this value stream. Now, what do we mean by value stream? So by value, you always look at it from the customer's perspective, or the patient's perspective, or the client's perspective. So when you go into Apple, like say the Apple shop or so, you are the customer. So everything they're looking at is, how do we provide value from the customer's perspective? A, no long lines for checking out. Everybody's got that little computer in their pocket that they can sell your phone right there and check you out on the spot, give you your receipt or email you your receipt, and you don't have to stand at any lines, except for maybe the line to get into the store, okay? That's what they've actually explored and say, creating value from the customer's perspective. So when we think about this value stream map, what does a customer want and what are the customers really willing to pay for? So a couple of bullets here. It's a visual representation of a process from the beginning to the end, but a higher level, okay? It actually also includes a lot of little different things. Time is the big one in the measures, maybe even supplies, maybe even a technology like Epic or so, or whatever technology you're using, maybe even communications. And it looks like the process from another person's perspective, normally the customer. Okay, so now we look over the right-hand side, we see suppliers, and we see some boxes on the bottom. And see those little squiggly lines at the bottom? Those are called sawtooths. So what we want to do with a value stream map is we want to do three things. What are the high-level boxes? And no more than about 6 to 8. So this is not like procedures. And no more than about 6 to 8. And also what we want to capture is 3 factors. How long does it take to do that actual task? How long does it wait before it moves from step A to step B? And then maybe also what's the total lead time? But really the most important things are how long does it take to do that actual task? See, compile names. How long does it take? And see that little bar in the middle? How long does it wait before it goes to this next step? So those are the 2 key ingredients that I would like for everybody to pick up. Okie doke. So now let's go to the next slide, please, Nisha. And so I'm going to go through these kind of fast because I want to store some time for everybody to actually do one. We're going to play with these and we're going to actually do a couple. You're going to do them. And hi there, Ria. It's so good to have you on the line. So
Hi,
why is it
thank you.
called the value stream? Okay, like I said, value from the customer's perspective. It could be a product, it could be a service, but even they want it at the right time, how they need it, when they need it. No more, no less. And this is what they want to pay for. Okay, so we, overbake it. I don't want that many donuts. I only wanted a half dozen donuts. You gave me a dozen. I can't eat them. I'm going to throw them away. I'm already, I got too much sugar in me. And my diabetes might get worse or something, or my blood pressure might go high. So, I can't absorb more than I need. It also talks about a stream. So when we talk about value stream, everything has a flow. So as improvers, what I would like for you to do is think about everything has a flow to it. Everything. It's got a beginning and an end. So the stream is all activities, both value added and non-value added. They require, something from a raw material, or not even raw materials, but everything flows. So if you take a look at that river there, it's flowing. It doesn't stop. And that's what we want you to think about, a stream. A stream always flows. And our job is, how do we optimize these streams? Okay. And then that map is a visual representation of the end-to-end work. But again, like I said, a value stream is not a process map. It doesn't have the details. Now, you can detail it down and drill down one of the boxes, but generally speaking, only like 6 to 8 high-level boxes of what goes on. That is the value stream. And then if you need to drill one of the boxes down, you can go down into swim lanes or more detailed procedural steps. Okay? So let's move on to the next slide. So when to use it? To understand the flow of information, really, I use the value stream for everything because it gives me a high-level picture of how things work. And I don't need to know the nitty-gritty and all the details at that point, but I start with how does it work from a big picture perspective or a high-level perspective. And then if I need to drill it down, I will actually drill it down, okay? And the key thing there is too, what I want to think about from a high level is what is value and what is not value. And a lot of times in, say, healthcare and in non-healthcare industries, we have a lot of things that are not value added. We do things because we're just used to doing it. But if you think about it and put those lenses on, would a customer really want this, or would anybody want to pay for this? Just give it a second thought, okay? So the next slide, please. So this is kind of how it looks, and it looks pretty busy, but it doesn't have to be. really all these tools are simple. And in the old days, guess what they did? They did them all by hand with a pencil and a piece of paper. So, the more sophisticated we got with all the technology, we just got fancy. But really, we don't have to. But if you look at this, okay, it's where the value stream is in the middle here. And all this other stuff around it is just stuff that gives us more information and insights around how do we look at and decipher this picture. So define requirements, product definition and conceptual design, detailed design, build prototype. We're going to test it. After we test it, we probably will implement it. That's the value stream. And then below, this is important. This is that sawtooth. How long does it take for us to define requirements? We think, say 10 hours. It could be a range of 5 to 10, but on the average, it's 10 hours. Then it waits for 3 days. Then product definition and conceptual design. It takes us 12 hours to do that. So how much time does it take for you to actually do it? And how long does it wait? Those are the only two real key measures you have to really think about your first time out, okay? So detailed design takes 24 hours. It waits for 15 days. Building the prototype takes 40 hours. It waits for another 24 days. Then we test it for 6 hours. Now, one of the things on here that we don't have on here, I don't have on this slide, is at the end of this, you would add up all this time. And you would say, okay, hey, it takes us 3 days, 15 days, 18 days, plus another 15. That's 33 days plus 24. That is actually 57 days to actually do this. Now, 57 days, well, guess how many hours this actually takes? 10, 12, 22, 24, that's 36. 36 plus 40, that's 76. 76 plus 6, so 82 hours and 57 days. So now, as a supervisor, let me just ask a couple questions, okay? So something takes you 82 hours for physically to do it, but it actually stays with us for 57 days. What do you think is wrong? Why is it taking so long in those wait times? So that's the thing. Now, I'm not going to answer that now, but that's the thing that this gives us a great picture. And so let's think about it. Okay, you gotta, like you are the boss, and you say, okay, this only takes me 82 hours of, hands-on work for somebody actually to do. And so that's about 2 weeks, a little over 2 weeks. But it takes us what? 57 days. Okay, 57 days. That's 8 weeks. So two weeks of work takes us 8 weeks to get it out the door. Okay, so that's where you want to stop and pause and say, do we have an opportunity to improve this? Okay, any questions? I want to stop and pause right there because that's probably the most important point. Okay, I will roll on. Next slide, please. And so we're going to remember that slide. We're going to come back to it. Lean concepts to know before you start this mapping. Okay, next slide, please, Nisha. And thank you so much. So like I talked about, value added, non-value added. And then we also have necessary stuff that we have to do. It might be government compliance, regulatory that we have to do, but it doesn't really add any value. Not to the customer. But we have to do it because, Uncle Sam or, state of California said you have to do it. Okay. Now, we don't have to do it the slow way and the worst way. We can optimize it, but we have to do it. Okay. Now, value added. This is stuff that you have to do, should do to actually add value to the outcome. Non-value steps is, okay, hey, historically, we've always done this and we're always going to do it, but it adds no value. So those are the opportunities to actually streamline or eliminate your process. So again, value stream mapping is one of the tools to use for improvement. It's my go-to tool for sure, all the time. So if anything, right, somebody said we got a problem, I always go first of all to the value stream map. Tell me, what is the value stream? Let's walk it through. Do you know it? And then we go from there. Okay, next slide, please. And then we have these other additional measures. We call it cycle time. And you can use this interchangeably, cycle time or hands-on time. Physically, it takes me X minutes or X hours to type up this report. Then we have the wait time. How long did I typed up this report this morning? But guess what? For some reason, I got lazy. I kept it in my inbox. I didn't send it over to Nisha until this afternoon. So, it's got some wait time. Now, why is it? So Nisha came back to me and said, well, Dennis, if you completed this at 9 o'clock this morning, why didn't you send it to me at 9:02 or 9:05? Why did you wait until 4 o'clock in the afternoon to send it to me? And I might say, well, Nisha, I was thinking about batching all the emails I wanted to send to you, and I all want to send them to you at once, which is not a good thing. It's a bad thing, okay? So that's how we want to look at this. And then we have the lead time, and the lead time is a combination of the cycle time plus the wait time. Okay, next slide, please. And then we also have this thing that's called takt time. Takt time is just a German word for beat. Okay. And now by beat, what we want to know is if we work X amount of time per day or per shift, and we have X customers who need to be served, how much time can we spend per customer to actually get all our work done today? So when you talk about, and I love, conversing with Rhea, because she's my partner in crime here, is that we have 20 blanket purchase orders that we need to process in a day. And if we only have X amount of hours or minutes in a day, in this particular case, we need to see 10 patients per day, and we have 240 minutes in a day. That's just 60 times, whatever, 6 here. We need to see 1 patient every 24 minutes. So that's the beat or the rhythm. Now, if a patient stays longer than 24 minutes in this particular example, guess what? We're going to be backed up. So if 1 patient stays an hour, guess what? We're going to be backed up and we won't get all our work done. So with the value stream map, those measures are crucially important to determine how many resources you need and how you can actually optimize your flow to get all your work done that particular day or that week, okay? Key term here, I'm going through it kind of fast, but this is somewhat important. Okay, next slide, please. And then we have these other concepts that we don't want to do. One thing that we don't want to do, so remember I talked about the emails? I completed my agenda report this morning, but I batched all of my emails to send to Nisha with other information in it until this afternoon. It's a bad thing. Don't do it. The reason why is, guess what? We forget. It sits in our inbox. Nisha's waiting for it, so she can't do anything with that until the end of the day because guess what? I waited. And then I sent her 10 at one time. So guess what she's got to do? All 10 versus she was ready to do it at 9:05. 9:02, she was ready to, okay, hey, you got your agenda. Let me actually go through it and see what I need to do to actually load it into the system. Okay, so batching for the most part is not a good thing. Now, if we have any providers on the line, a lot of times you batch your in-basket until the end of the day, or you take it home. And again, what I strongly suggest from an improvement standpoint is you do them as they occur. A, you don't forget stuff. B, it's fresh in your mind, and you can actually finish that one versus thinking about all 10 or so that you have to do because you're still kind of thinking about it. And so the goal is always to do continuous flow versus batching. And think about it like this too. You're at a restaurant and your server comes up to the table and they take your order and then they go to 15 other tables to take their orders before they go back to the cook. So guess what? You're probably not a happy camper because you have to wait for all of those other 15 orders to be taken before the cook can actually start preparing what you ordered. Okay? So batching is a no-no. Okay? Next slide, please. So these are the 7 flows of healthcare. And we're going to do a little exercise. The flow of patients, the flow of the family, warm, courteous environments, encourage communication with staff. The flow of medications, this is really a good one. Med rooms strategically located to minimize those staff trips. The flow of supplies. So where are the supplies located with respect to where the people need them? Especially like say in the OR or so, do they have to walk a mile to actually get their supplies, or are those supplies at their fingertips when they need them? Likewise, when patients are ready to be discharged, do they have to walk all over the hospital to get their meds before they can actually go home? Or does somebody else, a staff member, needs to walk all over the hospital to find where the meds are before that particular patient can be actually discharged? The flow of equipment. Equipment shouldn't actually clog the halls, and it should be flowing so it's a smooth transition from one piece of equipment to the next. The flow of information. How does it work from person A to person B? And the flow of healthcare staff. Where are things located to where they're needed? Where's the nurse station? Where's the teams huddling at? Where's the visual board based on where the need is? Okay. Next slide, please. So we talk about the whole goal of value stream map, and the whole goal of sum of improvement work is just to take out the stuff that's not value added, eliminate waste. So in these boxes here, the green is value added. The red is non-value added time. So anytime you got red, try your best to eliminate it. Sometimes you can't get rid of it all, but try. And then likewise, this is a gospel from the old school as well too. The more steps you have in a process or in your value stream, the less reliable it will be. Okay, so always seek the minimum amount of steps. Simplify. The more steps, the more confusion, the more complicated, the more variability. Okay, so our job as improvers are to simplify and reduce the number of steps. Reduce the number of steps required to complete a job. And that's how you train your staff, with reduced amount of steps. Okay, next slide, please. So gathering information before you start mapping or building your current state value stream map. Okay, next slide, please. So Ono circle, this is basically go to the Gemba. So don't do it in a conference room. Don't do it at home unless you're doing something at home. But go to where the work is. That's what Gemba is. Go to the work site where people actually work, or where patients actually come in and visit, and actually create your value stream map. Okay, next slide, please. And so you'll hear that word Muda is waste, and go to the Gemba is where the work is. Next one, this is a really good tool too. A spaghetti map. How is the setup in, say, your office or someplace else where people have to go? Or, how are the beds set up? Is the waiting area conducive for, where the patients need to wait? So by spaghetti map, what you're doing, you're tracking the flow of work and where people physically go. And then you're counting your steps and say, wow, you're running around the whole day. No wonder you can't get much done, because you're running around searching for stuff. Okay, next slide, please. And then likewise, I'm sure everybody's heard of how you time other tasks. Now, again, never time the person. You're never timing the person per se. You're timing the task, not the person. So you're not timing Rhea or Clayton. You're timing just how long the task takes. So task 1 takes 15 minutes. Task 2 takes 8 minutes. That's all you're doing, never the person. Okay? And what you're trying to do is just actually get estimates, because a lot of times you'll get these steps and you'll say, well, sometimes it takes 5 minutes, sometimes it takes 15 minutes. for the same exact step. That's where you'll take, say, multiple timings of the same step, and then you'll take a weighted average. So I took 20 samples, and on a scale of 5 to 15 minutes, the weighted average came out to be 9.5. And that's what we're going to use as the estimated time for that task. Again, most of these, unless they're actually documented in Epic and can be validated, are estimates. And even when somebody physically puts on, I completed this task at this time, you might want to go back and check and do some auditing, because again, you can put down at the end of the day what time you thought you completed it versus what time you did really complete tasks. So that's the biggest problem in healthcare. People actually updating the records or the logs after the fact with information, and then when you audit it and you find out what time it actually took is normally different. Okay, next slide, please. So mapping, okay, continue on. So this is just a busy slide, but we don't want to be busy. We want to be simple, okay? And it's got a lot of information on it. So go to the next slide, please, Nisha. Okay, and this is some of the tools that you can use. Look at that fishbone, or not the fishbone, but that sawtooth at the bottom there. And you can use a lot of different arrows. So you can, this is like almost like a little baby Picasso or Picasso. You can actually paint it and get really, really fancy. But the catch is, will it confuse your customers and clients, or your boss, or the others who you're trying to portray a picture to, or more importantly, your teammates? So you want to keep it simple and readable, and it makes sense from start to finish. Okay, next slide, please. Again, more pictures that you can put on the map. Okay, next slide, please. And then you use this for your currently how it is now. You can actually put on what's wrong, and then you can actually come up with a new map that actually takes out all the waste and all the unnecessary stuff. Okay, so this is what we're going to do. And we have a couple of people on the line. I would like for everybody, we're going to actually play a little exercise. We're going to actually create these together. And I want everybody to, we're going to give you like a few minutes to create it, and then we're going to actually share these out. So again, this is, we're going to actually learn how to do these in real time together, okay? So if everybody takes out a clean piece of paper, and this is our, we're going to create a current state value stream map for needing to see the doctor. All right. And Rhea, I would like for you to be my helper on this. If you would, ma'am, my coach. And we're going to do this together. And everybody else, if you would write this down on a clean sheet of paper. Okay. So first step, I woke up this morning, or you have a child who woke up this morning and they have a very, very sore throat and an ear infection. So the first thing we're going to do in our value stream map is, what do we think? And this is where we all talk through, and I want you to write them down on a clean sheet of paper. And always go horizontal. Go horizontal, long way on your piece of paper. And remember, no more than about 6 to 8 blocks. Okay? So step number 1 would be what? And let's say, Rhea, step number 1, what would you do? Okay, come off of mute, please.
Sorry. With the what was the scenario again? The kid has a fever, ear infection.
Your kid has a very, very bad sore throat and earache.
Well, the first thing,
so your first step is, in addition to taking care of your child, what would your first step be with respect to the engaging the medical community?
I will take him to the ER.
Okay. That's one way. Take to the ER. What about you, Clayton? What would you do?
Call the doctor.
Okay, call the doctor. Okay. Letty, what would you do?
I would check the child's temperature and give them medication if needed. And if it doesn't improve, then I call the advice nurse or make a doctor's appointment.
Okay, let's go with Letty. Okay, Letty, let's write that down. So let's say step one, check what? Say it again.
Check temperature,
Check temperature. And what else?
give medication if needed, like Tylenol.
Okay, so that's step number one. Check temp and give medication if needed, if temp is high, okay? Let's call that step one for everybody. How long would that take, Letty?
It would take about maybe an hour to see if there's a difference.
Okay, let's break it down. So now let's look at how long would it take for you to take their temperature and give medication?
Less than 5 minutes.
Okay, let's say 5 minutes. So that's the first one on your sawtooth. In between step one and two, step two is, let's just say, temperature continues to rise. And how long would you wait?
I wouldn't. I would call the advice nurse.
Okay, so call advice nurse. Immediately?
Once I notice that the temperature still hasn't gone down after giving them medication, I would
Okay.
call the advice nurse immediately.
How long would you wait before, after you gave medication?
I would wait maybe like an hour.
Okay, perfect. So does everybody follow me? So now we got task number one. Check child's temperature and give meds. 5 minutes. In between tasks one and two, we wait for 60 minutes, okay? Now Letty's gonna call the advice nurse. How long do you think you'll actually talk to the advice nurse? Assuming that they answer the phone and, you know.
Typically maybe about 20 minutes, because it depends on the time of day, how busy their calls are.
Okay, very good. Excellent, excellent, excellent. Okay. And now, advice nurse says, okay, hey, you've taken the temperature, you've given Tylenol and other meds. I would recommend that you bring your child in and make an appointment. I can make the appointment for you. So can the advice nurse make the appointment for you, or do you have to make the appointment?
They can make an appointment for you, but they can also refer you to an urgent care facility if there's no appointments.
Okay, so let's put that in. So step number three, call advice nurse. Step three is what? Advice nurse makes appointment. And do you need appointment for urgent care, or is it walk-in?
No, I think you can just do a walk-in.
Okay, makes appointment or contacts urgent care. You see, okay. How long do you think that will take?
Total, I think about maybe 30 minutes. I think with urgent care, you have to call them,
Okay,
and
so
you have to also call them.
somebody's got to call, right?
Mm-hmm.
And so probably between steps 2 and 3, it's probably almost like real time. You're going to talk for 20 minutes, and then that nurse is going to try to actually get you an appointment. Now, will it take 30 additional minutes, or maybe like less than that?
I think less.
Like what, maybe like 5 at the most?
10.
10. Okay. And you see, and the wait maybe be like what, maybe a minute or two?
Mm-hmm.
Okay. Okay. Everybody with me still? Okay, so now makes appointment to urgent care. Okay, so now let's see. Letty, you're going to take your child to urgent care. How long does it take for you, after the appointment is made, you got to get the child, get the child dressed and stuff and drive over to urgent care. How long is it going to actually take for you to do that?
About 20 minutes.
20 minutes to get to urgent care.
Mm-hmm.
So that's a wait time of 20 minutes. And I say it's probably not a wait time, but get dressed and drive. Okay. So that's 20 minutes of actual due time. Okay. Now you arrive at urgent care. What are you going to do?
Register, get
Okay.
checked in,
Okay.
pay any co-payments if they're needed.
Okay.
And usually if it's your first time, they verify insurance and all of that. They ask for all of that.
Okay. How
And-
long is all that going to take on average?
Maybe no more than 5-10 minutes.
Okay, say 5 to 10 minutes. And see, with value stream maps, you can use ranges too. Okay. So now they did that. Now what are they going to do?
We
Probably
wait.
have you sit in the lobby.
Yes, wait until they call us back. Then the
and
provider,
sit in lobby and wait. Okay. How long do you think it's going to wait? Let's just estimate for right now.
I would just say like 10 minutes.
Oh, that's pretty good. Okay. Now get called back into the room. What's going to go on there?
Typically the CMA will take the child's vitals, ask what's going on, document, do a report out before the doctor goes in to assess the child.
Okay.
And then once they do that, then the doctor comes in, assesses the child, and does whatever testing that's required. Since the child has a sore throat, I'm assuming that they would do like a swab to rule out strep or anything,
Right. Uh-huh.
and check their ears, make sure they don't have like an ear infection.
Excellent. Excellent. Okay. How long would that take? What, maybe like 20 minutes or so?
Probably.
Okay. Any lab maybe? Swab?
Depending on the assessment, but that would require going to another facility
Okay.
to do the blood work.
Okay. Okay. And then how long would it take to actually go to that next facility on
Depending
average?
depending on what it is, maybe another 30 minutes.
Okay, 30 more minutes. Okay. And then how long would you wait there before you're actually got your blood tested or so, or your swab?
It depends. If you're a walk-in, you're gonna wait longer than people that have scheduled appointments.
Right. Okay. Okay. So you get my drift here? You're waiting. Okay. And then eventually the lab will send the results back over to your primary doctor over in urgent care.
Mhm.
Then you would see that doctor again. You go back over there and wait again, right?
Usually they give you a call because it's urgent care.
Mm-hmm.
They'll give you a call or refer you to your primary. So, for example, if they did a swab,
Mm-hmm.
they send it out from their facility to their lab for testing, they are responsible for calling you back with those results and then giving you advice on what to do next.
Okay. Great, great. Okay. So thank you, lady, very much. That's just excellent. Excellent, excellent. So now if we go to the future, say, what do you think? Okay, so from a value stream map, where's the real value to Letty and her child? And what opportunities might we have? So first thing, you got to paint the picture. You did a great job. So now we added all these times up. How much time are we actually waiting in here? I just got my little calculations and it shows probably about 2.5 hours. And is that okay or not okay? So you tell me as a customer, as a mom.
I think that's okay because if I would have taken my child to the emergency room, we're looking at being there for 3 to 4 hours.
Okay. Compared to the emergency room, it's probably a good deal. Okay, great, great, great. And now, where will we have opportunities in here to actually streamline this process? So first, paint the picture. And I love what you said right there. It might be okay the way it is. And you might be a very happy camper. Okay, 2.5 hours, if I can actually get it taken care of, I'm okay with that. And do we have any non-value added steps in here? What do you think? Or can we rearrange any of these steps or combine or consolidate any? What do
I
you think?
personally don't think that you can.
Okay. So based on that, you think it works pretty well.
Yes.
Mhm. And then, so I guess my next question would be, every time you call the vice nurse, are they able to help with either that appointment in urgent care, your PCP, or say emergency room?
It really depends on the situation. Some things they can't help you with, and they'll just say, you know what, you need to call 911 now, or you need to call the emergency room now. Like if I would have said my child's fever is 105, that would have been an automatic take them to the ER now.
Which is great.
Mm-hmm.
So in that particular case, looking at the value stream map, if we're going to try to improve this process, it might be like, this is as good as we can get it. And 2.5 hours from start to finish, and my daughter has what she needs to get better, I'm a very happy camper. And I love, like you said though, lady, it beats that 3 or that 4 hours sitting in the emergency department. So the thing would be, that's how you want to look at it. And you want to actually know what those timings are and how long does it take for each step. So that's the big thing with value stream maps. So now let me just pause right there and just see, are there any questions? And can somebody give me an example of a value stream that they don't think is optimized? What about billing? What about contracting? What about behavioral health? What about follow-up appointments? What about overall access? What about the utilization of current appointments? Are they being utilized to their full degree? Again, I'm just throwing out examples. So the goal would be to actually examine your value stream and actually get the facts first. And once you have the facts, then you can step back, say you and your team, and actually determine, okay, hey, do we have opportunities to do any of these things differently? Or in this particular case, could the vice nurse actually place an order to actually have the pharmacy deliver medications directly to the lady's house based on X conditions? Don't know. Again, I'm just food for thought. Okay. So with this, let's just go to the next slide. And let's go back to the other slide, Donisha, with the, keep going. Keep going. Go back one. Right there. Okay. So now my question to you, and this is a data one, is, do you, I say Apollo as well too, are you able to create one for where you work at? And are you able to put how long it takes almost for each high level task, and how long does the wait between step A and step B? And so I'd like to just go around the horn and say, I say, Ria, can you, and you've done it, but what was your challenge creating a value stream for your department?
Getting everybody in the same page.
Okay.
That was my challenge when I was creating my value stream mapping. And we came with different timings because, you know, each process in our area are different. So we had to average those.
Okay.
So that was one of my challenges when I was putting everything together. And also some of the steps changed because, you know, I was using a sticker, you know, a sticky note, and then I had to switch my sticky notes when I was doing my value stream mapping. That
Okay,
was my another challenge.
okay. Remember, they're iterative. None are perfect, and others might not agree on the exact terminology. Okay, Clayton, where do you work at, sir? Yeah.
Health services,
Mm-hmm.
office
What
of the
would
director.
be what would be your value stream for your area? Top 5 or 6, pick just one thing, top 5 or 6 boxes from a customer's perspective.
I don't know if it's actually fixable. I think the number one is probably just wait time,
Okay, but
follow up.
let's not even go to wait time. Let's just say, what are the steps? So one process that you guys do that's part of your job, high level buck, is just what are the steps first?
Well, I guess on the simplest basis, the steps for like an invoice is
Yeah, let's just say.
receive
Mhm,
either by email or mail.
mhm, okay. Step 2, again, high
Step
level.
2 is review the invoice for accuracy,
Okay,
and also just review in general to make sure that all vendor information is,
okay.
do we recognize it? Do we recognize the charge? Is it our charge?
Okay, so that's good. So for value stream map, that's the level you need to. And then step 3, so you received it, you reviewed it for accuracy, you know, based on the checklist. Okay, step 3.
If it's not yours, send it somewhere else, or determine where it needs to be sent.
Okay, if we review for accuracy and we assume that it is accurate, what do we do after that?
Then we can begin processing.
Okay,
So
okay, we received it, we reviewed it for accuracy, we assume it's accurate, we process it. What do we do after it's processed?
well, it's done on our end, so we got to wait for finance to review it, and then we have to wait for the auditors to review it, and then answer any questions if those come up.
Okay,
And then if they don't ask questions, they may just send it back and then restart the whole process all over again.
if they don't ask questions, assuming that it's a good one. So we receive it, we review for accuracy, we process it, and what, do we close it out, assuming that it's no problems, right?
Yeah, and so once it's processed through all of the parties, it'll get approved for payment,
Okay,
and then that notification comes back to the initiator, and then you can close it out on your tracking.
okay. Now that's really about 5 or 6 steps. Does it make sense? So now what
Yeah.
you want to do too is, in addition to time, it's another element in here that I was going to bring up. In addition to time for each one of these steps, you also want to think about how reliable is it? Is it 100% reliable or is it less than? So does it circle back around repeatedly because there are errors? Or is that particular step 100% reliable and is good to go to the next step? Okay.
Is that a-
And so if it's not, if it's less than 100%, and that is what they call this thing, and it's not on here, but first pass yield. So each step has a yield associated with it. How reliable is that step? And the lower the reliability is, guess what? The more prone it is to error and rework. So that also might be an opportunity to actually say, we need to look at that particular step in more detail if it's less than 100% reliable. And those are multipliers too, okay? So now with yours, say your 6 steps over there, Clayton, you would actually add up, like the time, the actually hands-on time and the wait time. And what's the total cycle time for the whole thing, would you say? So to get one, say invoice actually approved and paid, how long does that take?
30 days.
Okay, 30 days. Okay. And are you reaching your target? Is that your target? That's pretty good.
My target would be less, but technically, according to most purchase orders and contracts, the payment term is within 30 days.
Uh-huh. Okay. Now, if you want to cut that to like whatever, like say 20 days, what would you do? Or which areas would you look at? So now you've painted your picture. Which areas do you think you would look at?
Well, I mean, the areas that I have control over, because it's a process that involves, so many different departments and people's
Okay.
eye all the time.
Okay.
So the areas that I have control over, trying to see if there's any
Mhm.
way to streamline or combine steps to make it a little bit more efficient.
Mhm. Which areas are those? The first, second, and third?
Yeah, I mean, the review process has kind of already, at least for me, I've combined it into the tracking. So the
That's good.
review and the tracking all happens all at once. So then
Mhm.
by the time you get that notification at the end of the process, it's just going back into that tracking and putting in a date and a check number.
Okay. So
But all the other information is complete by that point.
You pretty much improved it, which is good.
Yeah.
Okay, great. Thank you. Let's do one more. Where do you actually work at, lady?
I'm in health services. I'm a clinic coordinator for Antioch, Brentwood, and Bay Point Health Centers.
Walk us through one of your value streams, if you could. Just a high level test. And no more than about 5 or 6.
Oh gosh. Honestly, I don't know. Maybe when I submit a request for capital purchase for equipment, it's a very lengthy process. There's a lot of steps that I need to take.
Mm-hmm.
When doing so, like I have to request a quote from the vendor. Actually a few vendors, I have to request quotes. I have to do the paperwork, submit it, the capital purchase form, a sole source form.
Mm-hmm.
I have to submit the quotes and the justification forms on why we need to spend this much money on this equipment.
Mm-hmm.
And from there, it gets submitted to administration, like the COO,
Mm-hmm.
medical director. Then they approve it when they finally approve it, because it takes a really long time to get approval because of budgeting, I'm assuming. Then they send it to materials, which is Ria's department,
Mm-hmm.
create a purchase order for the
Mm-hmm.
equipment. So it's a lot of steps, and it's a little frustrating at times.
Very good. Now you laid it out. Have you ever laid it out for them how long does it take to get approval?
No, I have not. I mean, I see it as I'm not the only department requesting for capital equipment.
Mm-hmm.
There are other places that also require, for instance, the dental department is very equipment heavy. So it just depends on the need. For example, in the dental clinics, they desperately needed new exam chairs.
Okay.
which was a very expensive purchase, but also it was needed because the previous vendor, the manufacturer of the previous chairs, went out of business.
Mhm.
So when issues arise with the chairs, it's obsolete. The parts are obsolete
Mhm.
because they don't have the parts. They don't make them anymore to repair the chairs. So then that started affecting patient care because we were having to cancel appointments. And the dental department does generate a lot of revenue for the county
Mhm.
from Medi-Cal and Contra Costa
Sure.
Health Plan, Medicare.
Sure.
So it's for instance, in that department, it's very crucial to get these things
So your
approved.
thing is based on other priorities, that's probably why it takes so long.
Yes,
Mhm. Okay, okay.
because
But okay, so the catch is anytime, and this is for everybody on the line, from an improvement standpoint, yeah, absolutely. The the budgetary committee, they have to look at multiple and they have to prioritize based on, like what's at the highest priority at that particular time. So we don't want to get into that game. And at the same time, what we want to do is just be able to say, this is a picture that we've painted, and we might have to just accept these are the things, this is the way it is for certain things. And actually improve what we can and what we do have control over. Kind of like what you were saying, Clayton. I can improve these things, and we've actually taken steps to do that. So in any event, it's like 12:58. Does anybody have anything else? I want you to be able to really do a value stream map. Like I said, as an improvement person, regardless, this is where you said this is like your lifeblood. If you can actually do a value stream and just lay it out, what are the big buckets? How long does it take, and how long is it waiting in between? That's really like, say, the secret sauce. And you can see it, and you can actually say, well, I've been complaining about something that I shouldn't have been complaining about. It's really not that long. Like that urgent care example. If that's, the majority of the time, that's pretty good, actually. Okay. So in any event, does anybody have any other last minute questions or so before we adjourn for the day, and we'll be talking again in a couple of weeks? If not, thank you very much. Continue to do the great work that you do every single day. And it would be amazing if somebody actually did a value stream map and sent it to me or sent it to Nisha and actually say, okay, hey, this is my draft value stream map. I just drew it up. And this is my driver diagram. So I'm actually using these tools. And then what we would like to do is actually send them over to Erica and Anna and say, okay, hey, we have team members who are actually using some of these tools in their everyday work. So this is why we call it almost everyday PI. So take care, enjoy the rest of your Thursday, and I look forward to speaking with you in a couple of weeks. Thank you again, and bye now, everyone. So
Thank
turn it
you.
over to Nisha.
thank you.
Thank you.